Nitwa Nyirangaruye Gerardine, mfite imyaka 15. Itandukaniro mbere batari batanga iyi miti twasinziraga mu ishuri no kuruka tukaruka n'ibindi. Impamvu bari gutanga ino miti ni ukugira ngo tutandura indwara z'inzoka. Nimara gukura ndangije amashuri numva naba umwarimu. Mbona yuko kwigisha ari byiza, nkigisha abana b'u Rwanda kugira ngo bamenye ubumenyi.
Impamvu natowe n'abaturage banyira icizere mbambaye umujyanama w'ubuzima, nkorera hano ku kigo nderabuzima cya Gashaka. Ndakishimira rwose kandi ngakora mfite umurava kuko nshinzwe kubungabunga ubuzima bw'abaturage. Ndabyishimira cyane rwose. Mu giturage muri community izo ndwara zaragabanutse aho haje iyi gahunda yo kuvura abana inzoka zo mu nda. Yaragabanutse. Kera wasangaga umwana yaratumbye inda ari zo nzoka zipakiyemo, ariko none aho tugiye dutanga ibyo binini by'inzoka nk'abajana b'ubuzima nta nzoka zikigaragara mu bana. Kandi n'ikimenyimenyi murabona bari abana turi gupima, turi guha biriya binini by'inzoka, muri kubona bafite ubuzima bwiza nta kibazo.
Very good afternoon to you all, and good morning, of course, to those who are still at the start of their day. We are so pleased to be able to convene and to discuss the importance of public-private partnerships in addressing some of the world's most widespread problems. Our esteemed panelists today will share insights from Rwanda's experience of such a partnership, where continued and progressive government leadership has been met with commitment and innovation from leaders within the pharmaceutical industries. Lastly, we'll be able to converse and learn from lessons learned during this long-standing partnership. I'd like to start off by just introducing our panelists and a few housekeeping rules. I have put a message in the chat box. Welcome to you all. Please feel free to introduce yourselves in the chat box. Let us know where you're dialing in from and let us know what organization you're with. In the meantime, I'm going to start off by just acknowledging and introducing our panelists. First off, I'd like to introduce Honorable Minister Ngamije, the Rwandan Minister of Health. He leads the development and execution of the health sector strategic plan. Prior to this, he served as the Director for Malaria and Neglected Tropical Diseases in the World Health Organization's country office based in Kigali. Dr. Daniel has served in different capacities in the entire Rwandan health system since 1995 and has held a wide range of leadership positions. Thank you for joining us, Honorable Minister.
Thank you.
I'd like to also welcome Lynn Leonard, who is the Soil Transmitted Helminth Global Program Leader with Johnson & Johnson. She's responsible for the management of Vermox, or the mebendazole donation program to the WHO, and it serves 200 million doses of mebendazole annually to children in STH endemic countries. She has over 25 years of experience in the pharmaceutical industry. Thank you for joining us, Lynn. Next, I will introduce Johannes Waltz, who is the head of the Merck Schistosomiasis Elimination program at the German science and technology company Merck. He is responsible for the placement of 250 million tablets of praziquantel for the treatment of schistosomiasis throughout sub-Saharan Africa and beyond. He's also Director of Strategy and Finance of the Global Schistosomiasis Alliance. And prior to that, he was at Pfizer in various roles throughout his tenure, managing strategic engagements with private and public organizations in the global health arena. Thank you for joining us, Johannes. And last but certainly not least, I'll introduce Sean Kerrigan, who leads the World Vision Rwanda team responsible for serving vulnerable children in Rwanda with an ambitious goal of improving the lives of 4 million children by 2020. His portfolio includes oversight of technical programs, including livelihoods, health and nutrition, education and water, as well as sanitation and hygiene. Most recently, he led the global WASH team responsible for oversight and technical support of WASH projects and programs in more than 60 countries. And I did not introduce myself. My name is Joy Ruwodo. I'm Public Affairs Director at the End Fund, and the End Fund is a private philanthropic initiative leading the charge, helping to address issues to do with neglected tropical diseases. And our focus is the 5 most prevalent diseases, schistosomiasis being one of those, intestinal worms, river blindness, trachoma, and others. Thank you again for joining us. Please feel free to ask questions directly to our panelists because we will have a time for question and answer as time progresses. And I'd like to now officially hand over to Honorable Minister Ngamije to take us off with the program. Thank you, Minister.
Thank you, Joy. Thank you, colleagues, panelists, and thanks to all people attending to this webinar. So I'm honored to share with all participants Rwanda experience in its efforts to control NTDs. My remarks will be focused on 3 points. One is how policies changes we made were there to guide us to improve or to reduce the prevalence of intestinal worms and schistosomiasis. The second point that I will comment is the importance of coordination between WASH sectors and NTDs people. And of course, the importance of drug donation for NTD elimination. I think today it's a water day. It's a big day, and we know that there is a lot of NTDs that are in relationship with water. What we did for the last, let's say, 15 years is that we did MDA campaign like any other country, doing mass drug administration, and later on proceed with some surveys to see the impact of it. But we came to realize after the first series of years of MDA from 2008 to 2014, that the prevalence was not really reducing as we would wish. And again, from 66% of prevalence regarding the intestinal worms, we noted that the prevalence was 45% of kids with intestinal worms, where we did our survey. And we noted also that in some districts that are high endemic, we even went with 50% of people with the prevalence of this disease. For schistosomiasis, the decrease was really very small. From 2.8% in 2008, we noted 1.9% of prevalence. And then we continued with, again, MDA as an intervention to reduce the prevalence of this disease. But recently, the survey that we did, a mapping survey that we did, we noted that the decrease was really very, very minor, because we remain with 42% of prevalence of intestinal worms. And we noted that adults who are not targeted by the deworming campaign were with 49% of prevalence of this disease. Definitely, adults were like a reservoir of these intestinal worms. And we noted that so far the disease was business of the Ministry of Health. Involvement of other sectors was not really as we would wish to have it. That's why we decided when we were developing our recent strategic plan for NTDs to do some changes. And among those changes, one was to include adults, especially in high endemic districts, for both intestinal worms and schisto, part of people who benefit the treatment. The second shift that we did was to go from 2 MDA, mass drug administration, to 3 per year, so that especially in high endemic districts, so that we like keep momentum and we intensify this treatment so that we can reduce the prevalence toward the elimination of this disease. The other shift that we did in terms of policy change was for the drug delivery, rather than having a vertical program bringing drugs up to the health center, we decided to go up to the village, working with community health workers who identify people to benefit in the village, and then being there to distribute in a kind of routine distribution rather than having a 1 week for distribution like it used to be. But it's like we have special time to distribute, but not necessarily called special campaign for distribution, because it brings some additional cost that we could not afford. The other change we did was like to manage the operational cost of this distribution of drugs and the campaign. In the past, people were considering MDA week or mother and child week to be a week where it's an opportunity for making some income, some per diem, rather than focusing on what should be implemented as activity in a routine way. So we decided to keep only reasonable operating costs at the lowest level, at the health center and the village level, and make sure that drugs are arriving to those in need of it. The other shift that we did in terms of policy changes was to expand our partnership to other sectors like the telecommunication companies, to bring them part of our partners so that they can display continuously message of prevention of this disease, calling people to change their behavior, especially the whole WASH strategy, and so that it can bring behavior change rather than keeping them, the way we used to do of having 1 week, 2 times per year, talking about intestinal worms and schisto, and then we close the business until we have another campaign. Between 2 campaigns, it's like we are no longer talking about intestinal worms and schisto. So today we are not waiting the campaign to talk about this disease, because we can work with different partners like telecommunication companies to display continuously message to the population, and also involve different partners to communicate about NTDs. The last was the multi-sector collaboration. As I said, NTDs should no longer be a health issue only. It's multi-dimensional, multi-sectoral problem. So we require the involvement of different institutions, and this comes to the second point where I talked about coordination between NTD and WASH sectors. I want to talk about 2 big partners in the public sector with whom we are working now. We used to work with Ministry of Education for distributing this drug in schools, but for the first time, we are now working with the Ministry of Infrastructure to know and to have visibility of their program for access to clean water. Today, we know their targets. We know that they need to produce this quantity of clean water and distribute in areas where there is a need for clean water. Then we can monitor, we can have visibility on their targets, and we can monitor how they implement those targets. We know different targets they should reach, like percentage of household with improved source of and drinking water, percentage of households using improved sanitation or toilets, water production, etc. So the Ministry of Infrastructure and the Ministry of Local Government and the Ministry of Gender and Family, because the Ministry of Local Government, that this is the ministry in charge of making sure that in each household they have toilets, which is meeting standard and it's used properly. So this partnership brings us to collaborate with those sectors and to make sure that we are together and we are all accountable. It brings kind of mutual accountability, so that we make sure that we address NTD's issues as different sectors working in the same direction. Another change that was observed was again the point related to the involvement of partners for drug donation. We know that drug donation will remove potential financial barrier. There are people who can afford to pay necessarily these drugs. Although we have in the country a system of community health insurance, but there is a premium, there is a co-payment that you should pay to get the drugs. But having this drug donated for free the distribution also is for free. This is an incentive for anyone to get the drug and make sure that no one is untreated just because of any financial barrier. We receive drugs from different partners through WHO for conducting our campaign, and we are really very thankful to those pharmaceuticals companies and to the WHO serving as intermediate structure to reach these drugs. Now, especially for the intention of making 3 campaigns per year, we appreciate the commitment we receive as drug donation from different companies. Merck Pharma in collaboration with the End Fund, Johnson & Johnson, Vitamin Angel, and its local NGO called Home for Hope Foundation. We believe that this partnership will help us to implement the change that I talked about regarding the improvement of distribution of these drugs in endemic district, and to make sure that these drugs are available for that. Last, it's about one clinical trial that we want to conduct with ivermectin and albendazole to treat Schistosomiasis in endemic areas where we noted that this intestinal worm is not responding effectively to albendazole. This is a critical issue, and we appreciate this partnership of having ivermectin and albendazole for us to conduct this trial in coming days. Before ending, I just want to say that with those changes I described, involvement of different sectors, some innovation in terms of our strategic plan, and commitment from different partners, we believe that by 2024, we want to reduce by up to 20% the intestinal worms as prevalence from 42%, the current level. And for Schisto, we want to be at 0.5% as prevalence for Schisto. Rwanda is very grateful to WHO, all partners, pharmaceuticals company, and fund, Vitamin Angels, and other partners for your great commitment in supporting us in our journey toward the elimination of NTDs by 2030. And I wish to reiterate and wish all of you to be in Rwanda in June 2021 for NTDs and Malaria Summit during CHOGM 2021. I thank you so much.
Thank you so much, Honorable Minister, for that address. And also, of course, for acknowledging that it's World Water Day today and just the importance of water sanitation and hygiene in ensuring that we can break transmission of disease. I often talk about childhood memories of myself, and especially when we would visit in rural Africa, about running around near the water and being, the fear of God being put in us by parents to say, don't run around barefoot because the worms will come in under your feet. And I'm so privileged to be in work that addresses these issues that so many people are still faced with today. Thank you for talking about the efforts targeted at behavior change, which are so important. And also, of course, the ideas of innovation and increased number of MDAs to intensify treatment and sector collaboration. I'm reminded of a saying that has become so relevant in today's world, which is that if you want to go fast, go alone. But if you want to go far, go together. And I think that speaks exactly to these partnerships that we have. And so I'd like to hand over now to Lynn, if you can take us forward from Johnson & Johnson.
Thank you, Joy, and thank you so much to the End Fund for coordinating this forum today and to join my esteemed colleagues to address what is such an important topic. With it being World Water Day, it's really a time to reflect on what a privilege it is to have clean water, and the fact that nearly 30% of the world's population doesn't have access to it. It really heighten the value of clean water as it relates to health, and the fact that without it, you often are exposed to many debilitating illnesses of those neglected tropical diseases. J&J has really had a long-standing commitment in the area of neglected tropical diseases. Our deworming initiative in terms of donation began in 2006, and to date we've donated over 1.7 billion doses globally to endemic countries. And our focus has primarily been on treating school-age and preschool-age children. But as we advance into the next decade and really look to support the World Health Organization NTD roadmap, we're all looking for new and innovative ways in which to accelerate our progress, to work collaboratively across sectors and really drive greater impact. We know that community-based deworming can help to accelerate the progress in certain areas. So when the End Fund and the Rwandan government came forth with an ask or a need for additional drug to support expanded populations, adults in high endemic areas will help to really combat STH as a public health program within their country. We know that health for all, or having health within these communities, is so vital. And it's not just about the drug. And so the idea of working collectively with the End Fund and being able to provide the donation to Rwanda has afforded the opportunity for unlocking funds, and the End Fund is leveraging these funds through the Deworming Innovation Fund. And these additional funds can really be used for enabling greater investments in capacity development, health system strengthening, all the things that can be valuable to the Rwandan government as we look to progress our efforts on STH. We do believe that collaboration is at the key of success for anything that we work. There's no one sector, no one solution that can solve these problems. And so we really want to work with governments, work with private organizations, and say, how do we come together in a collective fashion to raise the impact that we're making, and most importantly, generate innovation that helps us tackle some of the biggest health challenges. So with that, we're happy to support the Rwandan government with their STH strategic plan. We hope that the 15 million doses that have been brought forth can make an impact within those high endemic areas, and we look forward to hearing about success in the future. Thank you.
Thank you very much for that, Lynn, and for, of course, citing the new World Health Organization's 2030 NTD roadmap, which charts an ambitious path to NTD elimination over the next decade. And to your point, we won't be able to achieve those targets in the absence of the kinds of partnerships that we're talking about here today. And these donations that you generously provide, which allow us to unlock the ability of organizations like ourselves to be able to just drive health systems capacity within the countries that we're operating in. I would like now to pass on to Johannes from Merck. If you can go ahead, please, and take us away. And just a reminder that we are very happy to receive questions. So please continue to put in those questions in the Q&A, because we will have an opportunity to engage more deeply answering questions from our attendees. Thank you, Johannes.
Thank you very much, Joy. And thank you to the End Fund to invite us here to this important panel today. And it's a great pleasure and a great honor to be here together with colleagues, and above all, Dr. Ngamije, whom we will very much look forward to work closely on the elimination program of schisto in Rwanda in the coming months and beyond. Allow me to give you a very quick sort of background what Merck has been doing in schisto and its engagement and investments over the last decade or so. We started to invest and engage ourselves in schisto in 2007, originally in partnership and continue in partnership with WHO, committed at that time smaller amounts of praziquantel, which remains the gold standard for the treatment of schisto. And then in 2012, with the signing of the London Declaration, committed to provide up to 250 million tablets of praziquantel for the treatment of school-age children, primarily until elimination has been achieved. That's not a mean and easy target. Until elimination has been achieved, we are aware what sort of challenges that involves and entails. So up to date and similar to Lynn, we are in the 1.3 in our case billion total provision and donation of praziquantel. We come up with these enormous figures behind which, of course, humans and 520 million of them have been treated, human beings, and in our case, primarily children stand. It's mind-boggling figures, and we are now up to about 90 million school-age children whom we treat with our praziquantel per annum in about 47 countries all across sub-Saharan Africa, including, of course, Rwanda. And Rwanda, where we have provided a total of around 16 million tablets since 2011, and we are very happy about the way treatment campaigns have been running in Rwanda since that time. Donation was, of course, and continues to be at the core of our activities, provision of praziquantel. But 2-3 years ago, we refocused a little bit, not going away from praziquantel provision, but saying, oh, if we are in this until elimination has been achieved, we really should focus a little bit more on that. So we renamed our program to Merck Schistosomiasis Elimination Program, which you may say is semantics, but there is more behind that because we developed also an integrated approach where tablets, if I put it like that, continue to be at the center. But we also have very active programs in our Merck Global Health Institute, around research and development of additional sort of tools and interventionist sort of options for the elimination of schisto. We develop, of course, the pediatric formulation of praziquantel, which is expected to come online in a couple of years' time. We have a partnership with Johnson & Johnson to sort of improve the diagnostics with what is now called K&K 2.0 to use artificial intelligence to diagnose schisto and SDH for that matter. We also work on a rapid diagnostic test, and we have in partnership with FIND, and we have programs and investments in behavior change, education, and partly WASH. WASH, of course, is too big for us to chew on, to put it like that. It's a huge investment partnership. Lynn already mentioned it, is absolutely at the slide of all these activities. Elimination efforts, of course, and let me come shortly to our Rwandan engagement. Elimination must involve treatment for all age groups. We have, as I said, in the past focused primarily on school-age children, and then said, well, we must be more open, flexible. We have the ceiling of 250 million tablets per year, but there's a lot happening which really opens the road to a more all-inclusive approach for treatment with praziquantel. Dare I say, there's a lot of movement in the context of precision mapping, etc. going on. So we can do more than we did in the past with the 250 million tablets which we invest. And that, of course, coincides with the roadmap, elimination all around us until 2030, huge commitments, huge challenges, and we are in the middle of this as the agenda unfolds, so to say. Very quickly still, partnership absolutely at the heart of all our activities in Schisto. That's our NTD, to put it like that. But we are guided by the commitment of countries as they move to meet these high targets, these ambitious targets which the WHO has set. In this context, we have looked at Rwanda as a prime example of sort of moving into the elimination sphere. Dr. Ngamije has already outlined it in detail. And when this in discussion, this was brought to us that here is Rwanda wants to go into this strategic, very dedicated, very clear plan to eliminate SDH and schisto, we were all up for it. And this is where our commitment came in. 8 million tablets for adult treatment together to be provided together with the End Fund. Here we have this great example of a great stakeholder, a key stakeholder in NTDs, teaming up with us, with J&J, to bring forward or to progress this ultimate aim of schisto elimination in our case. The schisto world needs this. The schisto world, and forgive me, Lynn, when if I focus on schisto, but the schisto world desperately needs the best practice example for elimination. We need to prove that it is possible in sub-Saharan Africa. Unfortunately, this wasn't the case until now, but now we have this great opportunity, and we have the greatest of confidence that Rwanda is in a prime position to prove exactly that schisto elimination is possible. And we are delighted to be in the middle in partnership with all our additional partners to make this happen. Thank you so much.
Thank you very much for that, Johannes. It's interesting because it's not often that you get partnerships that are so authentic that you can have competitors sitting in the same panel. So we do recognize that and appreciate having both Johnson & Johnson and Merck sitting around the table discussing with us. I think what makes me so passionate is the number, you were talking, Johannes, about the significant numbers of children that have been treated. And this is so near and dear to me because when we talk about the statistics of Africa, we know that Africa has a youth bulge and that there's a higher percentage of youth within African economies than most other countries. And so I do believe that we owe it to them to ensure that their futures are not curtailed by issues like preventable diseases, which we can actually put an end to. So I love your optimism when you say that, you know, elimination can be reached. I am there with you. We are rooting for seeing an end to these diseases. So thank you very much for that. And I'd like to now hand over to Sean, please, from World Vision.
Thank you so much, Joy. It's wonderful to be with you. Thank you to the End Fund for the invitation and this wonderful panel. It's inspiring to hear about all that partners are doing together. And I want to pick up specifically on the Honorable Minister's mention of the focus of the country of Rwanda on water, sanitation, and hygiene, and how that relates to NTDs. I have the honor and pleasure of leading World Vision here in Rwanda, and it's a wonderful team here focused on children. World Vision is a Christian organization focused on children, improving children's lives. We're community-based, ensuring that the work that we're doing is helping vulnerable children pull themselves out of those vulnerabilities. And certainly there's nothing that breaks our hearts more than seeing children suffering from preventable diseases, especially the NTDs that you're all mentioning about. And we've partnered with Merck and Johnson & Johnson all over the world. We're so pleased to do that. And but have been doing something unusual here in the country of Rwanda. I think because of the great leadership of this country. The Honorable Minister mentioned the strategy of transformation, of elimination, and the need to invest not only in the treatment of disease, but also the prevention of disease. And they put together very ambitious plans, and not only for the elimination of these diseases, but also for ensuring that each and every person Rwandan has access to clean water and sanitation by the year 2024. It's a really, which is just around the corner. It was back in 2018 when I arrived in this country, when I was presented these, and at first thought, well, these are too ambitious, but learning about Rwanda and the ability to take on ambitious projects, I was quickly inspired by the people here in Rwanda. And World Vision began asking the question, could we make a significant contribution to this plan? And in 2018, we did that as we looked at both the challenges of the country here, as well as the opportunities and the vision of its leadership. World Vision saw that there are about 6 million Rwandans that didn't have access to clean water and sanitation at the time. And with an ambitious goal of reaching everyone, World Vision asked the question, could we make a commitment to reaching a sixth of those and invite other partners into that to help Rwanda achieve its vision? And we did just that. We made a commitment in 2018 that we would reach 1 million people in Rwanda, primarily in rural areas, to help with the prevention of disease and to improve children's lives. Of course, we couldn't do that on our own, and that's where the excitement, I think, comes when we talk about collaboration. World Vision brought together many private sector individuals and corporations, foundations, to raise the $50 million that it would take to complete that commitment. And we also partnered very closely with the government of Rwanda, specifically the Ministry of Health, the Ministry of Infrastructure, which the minister mentioned, and the Ministry of Local Government. And when we partner with the government, we each are bringing resources to the table, both in terms of financial resources, but also technical expertise. And we've ramped up and scaled up the work that we're doing together. Last year, we reached more than 250,000 people, and we're more than halfway through that commitment to bring 1 million people access to clean water, both at their homes as well as in their schools and in their healthcare facilities. And I'll end on this note. You know, we took on a very ambitious goal. We thought that we were probably biting off more than we could chew, but we've seen the excitement and inspiration of the vision of being able to tackle the root causes of vulnerabilities together. And that was, I think, validated most visibly this past year as we faced the challenge of COVID and how important water and sanitation, hand washing have become, not just in facing these NTDs or Ebola, but now COVID. And we've partnered together with the Ministry of Health, focusing on, for many years, the access to water, access to hand washing stations, to soap. And these investments that were envisioned many years ago now are being verified as very important and have enabled Rwanda to face the challenge of COVID actually rather remarkably. So can we do this? Yes, I believe we can. And I think Rwanda is a great place to show that it can be done.
Thank you very much for that, Sean. The access to clean water narrative is so important. Today is actually Human Rights Day in South Africa. And I think we really need to remember that access to clean water and sanitation is a basic human right. So it is all the more important for us to ensure that this is achieved. And as we were talking, you were mentioning about COVID-19 and the lives that we're living right now. And it has felt in the last year like we're in the middle of a global hand washing campaign. So I think you are quite right. It's an opportunity for us to seize and for us to move forward with, to ensure that we can tick those boxes and have everyone having access to clean water and sanitation. So thank you very much for your efforts in that regard. So thank you very much to all our panelists for sharing some great insights, lessons learned. We're going to be moving into the next section, which is the question and answer session. And what I will do is, I think I'm going to give a few of the questions that I've seen here in the Q&A section on the webinar. And if we can have panelists please respond to those that are directed at them. I think one of the first questions that came up is, how is the coordination of the various partners like? How often do you have meetings and who leads them? And I suspect this will be directed at Dr. Ngamije. Honorable Minister, if you may, please. While I give you a moment to think about that, there is also a follow-up question around policies. Do we have policies in place to guide the various players for commitment and accountability? And I think with those two, if I can give you a moment to answer, and then we can move on to the next few.
Thank you so much. Thank you so much, Joy, for these two questions. For the first one related to how, the way we coordinate and we organize meeting with partners. So at the beginning, we plan together with, we work together with different representatives of different institutions at the time of developing our national NTD's strategic plan. So we agreed on that each one should be responsible for, and they were included in our strategic plan, either for production of water or construction of sanitation and washing stations. So different sectors were involved depending their area of expertise. The way we meet is that normally once the plan was adopted and validated, we are now implementing the plan. And at quarterly basis, the national program, the division in charge of NTDs release a report, a quarterly report of implementation activities, and then it's shared with partners. We have this kind of either virtual meeting or just the report is shared with partners and they can give feedback regarding the content of the report. For the policies in place, we have what we call in our language here, imihigo policy, means it's a performance contract that is signed between the central government, the President of the Republic, with ministers at the central level, but also mayor of district. And the content of those performance contracts reflecting different priorities that each level agreed to implement. Like for the district, among key indicators that they are accountable for is to work with the central level for the distribution of safe, clean water, but also construction of hygiene facilities and wash station. And then we can monitor completion of these activities at semester basis. But at the end of the year, there is a big event for, awarding the district which performed better than others in front of the president. So which gives a serious visibility and commitment to each one involved in this joint planning and implementation, the visibility and required accountability. Because to report to the president that you are the first, it's always a pleasure. To report that you are the last one, I think it's not a pleasure at all. So each one is really involved to make sure that they perform and they make sure that these facilities are used, because you might have those facilities, but people are not using it properly. So then behind you have support from different partners for producing materials and for teaching people to use efficiently those facilities. So again, it's about awareness campaign for behavior change. It's around all this joint intervention that we work together to make sure that each one is accountable to deliver for what he's competent for. Yeah.
Thank you very much for your responses, Honorable Minister. Sorry, did I hear someone else wanting to come in on that of our panelists? If not, I will move on. There are a few other questions that we have received. Some of them came in advance. But one of them says, what efforts are being made by drug donation companies and the government to move towards country sustainability? Another one, which was targeted at, I suppose, Johnson & Johnson and Merck. How important is this unprecedented partnership to your own company stakeholders, e.g. employees and right through the system? Then one, which perhaps, Sean, you could also get into, what are the major challenges to public-private partnerships? How have you overcome barriers? If I can leave that to our panelists, if you can please feel free to unmute and go ahead and tackle the questions.
Lynn, there were two questions for the pharma sector. If you want to go ahead, ladies first. I don't want to
Okay,
argue.
thank you. And Joy, can you just the first one, please? My pen wasn't working.
No problem at all. One was, what efforts are being made by drug donation companies and the government to move towards country sustainability?
Yep.
And the next one, how important is this unprecedented partnership to your own companies or to stakeholders within the company, especially employees?
Okay, the issue of sustainability is really at the core of our donation program now, and actually comes up in internal meetings every time. So much so that We are currently in the process of transitioning our donation program from what was a solid formulation to a new chewable/dispersible formulation, which allows for one size fits all dosing from 1 to 101. And when this formulation was specifically made for the donation program, and we consciously made an effort not to patent the formulation. We are now in active conversations with a variety of partners about how do we bring forth this formulation through generic companies, and really work with many stakeholders to ensure that there's quality, affordable medicine as countries look to graduate out of formal donation programs into sustainable management of STH. So that's one thing we're actively involved in, is our quality, affordable medicines effort that leverages our innovation and brings it into the generic forefront. And with regard to importance to the company, I think J&J long stands by our credo, and that we have an obligation not only to our shareholders and our employees, but to all the people we serve with our medicines and the communities in which we live. So undertaking an endeavor in public health, such as combating STH, is quite critical. And it's something that we report on in a variety of ways to our shareholders.
Right, maybe.
Thank you very much, Lynn. And Johannes, you're up.
Thank you, Joy. Just to complement what Lynn said, and of course, most if not all of it applies to us in the same way. As far as the sustainability is concerned, I think we are just at the very beginning to open this new chapter in what was the drug donation programs, to go into an area, or an era rather, where we look at potential co-financing, potentially with countries. It depends on, I mean, we work as our pharma colleagues and Johnson & Johnson does in so many countries. You can't put it all in one sort of pot and say, that's what we are now going to do with all of you. Absolutely not. Some countries will be able to go into a co-financing type of environment. We are looking at potentially local manufacturing. Lynn, you touched upon that. It will depend on, we are ready to do tech transfers where feasible, where possible, with our, of course, standards to maintain the quality standard of the tablets. But we are really at the beginning. The WHO sustainability framework as integral part of the roadmap sort of goes into this direction. The investment framework will come up. So we jointly look at that in the industry amongst the NTD pharma donors, and bear with us together with governments, of course. It's not us, it's partnership, and it's partnership all over again in this context of sustainability as well. And just how important is it to pharma stakeholders? Hugely important. Our employees, our colleagues in the company are proud about what Merck is doing in this field. It not only makes them feel good, that wouldn't be enough. It really involves them. People want to know more about it. We hear it every day where colleagues come to us and say, can we work with you? And we would love to include all. It's not always possible. But there is huge interest within the company, but also externally, even amongst investors. Let's not forget sustainability, this big bag of issues, also includes investments in NTDs, includes things beyond the pure sort of bottom line effort to produce revenue and positive sort of impact, but it also goes far beyond that for investors as well. So right across our stakeholders, internal and external, this is a hugely important issue.
That's very good to hear. Thank you for that, Johannes. If I can direct a question to Sean, there's a question from Emmanuel Aniki, which says, NTDs cannot be effectively eliminated without a robust WASH contribution. How effective has partnering with other WASH implementing partners helped, and how are reports collected, or how is the progress being reported?
Thanks, Joy. And it's a great question, and it's related, I think, to the other question you asked me, which was what are the challenges to building partnerships? What are those private sector, public sector partnerships? And I would boil down the fundamental challenge to trust. We speak different languages. We have different backgrounds. Those things. I know internally, as we launched a campaign to significantly invest in this sector, there were many internal voices that were saying, "Oh, if you do this, you're gonna have substitutionary giving. You're gonna take away from someone else." Those things, and that has not been the case. And I've learned that, I think, being here in Rwanda by three focus areas that Rwanda has, which are unity, accountability, and thinking big. I think as we work together in a unified fashion, we can accomplish so much more than we have started out doing. But in that, we have to hold ourselves accountable and hold each other accountable for doing the things that we said we were going to do. And that's where, the Honorable Minister shared the strong focus of the government here on accountability. If we're going to say we're going to do something, we better fulfill on that. And the last piece is thinking big. In this sector, what I appreciate about the End Fund in bringing together dialogues around this is you force the conversation around thinking big. It was only a few months ago I was sitting with a child and asking about his dreams in the southern part of Rwanda, and he was sharing that his dream was that he would be free from disease because he would get a water tap within his home. And when he shared that, his family laughed at him, which I thought was actually quite, it actually struck me as something that we need to be very careful of. Sometimes the people that we love, even perhaps our own children, we think their dreams are too big. But that's not what we're doing, right? We are dreaming big with the Sustainable Development Goals, that everyone will have clean water, that we have the ability to eliminate NTDs and work ourselves out of a job. These are big dreams, but if we don't have those big dreams, then we certainly won't accomplish them.
Thank you, Sean. I love that. And you're quite right. As we sit within the End Fund talking about our dreams and what we aspire to achieve, we actually are effectively saying we're trying to work ourselves out of our jobs so that we can move on to bigger challenges and greater developmental issues as the world moves forward. So thank you for that. Honorable Minister, you invited us all to Kigali for the Commonwealth Heads of Government meeting earlier on. And I know that we are currently planning for the Malaria and NTD Summit alongside CHOGM this year in June. And there's a question that's been submitted, which says, how can NTDs and malaria communities, amongst others, collaborate more effectively? If I can leave that for you to answer. And then there's another question in the chat box, which says, how has the Rwandan government addressed capacity issues where support of the national NTD program is concerned? And how can partners best support these efforts in ways that lead to local ownership?
Thank you, Joy. I think we are excited to be with malaria and NTDs communities at the end of, around June, 24th June. It will be a pleasure to be with all of you as we put together effort to achieve more, especially for the control of malaria and NTDs. We know that from the last CHOGM meeting in London, commitments were made, especially for malaria, to have it by 2023. And people are working to make sure that we reach this objective. For NTDs, there is a new roadmap. We intend to have a Kigali Declaration on NTDs. I think this is a good time to make sure that we reflect in Kigali Declaration all our ambitions that we have in NTDs roadmap. So the way to work together is that it depends with countries. Like for us, we decided to go for integration of these two diseases in one department or in one division, because all of them, they are about parasites as causes of this disease. So we put together efforts. We don't duplicate. We do economy of scale so that we use resources for malaria and NTDs together, especially for the ordinary budget, so that we can have staff who, like the head of division is also head for malaria and head for NTDs, which rather than having two head of divisions, it brings integration. So this is the word that I want to we work for integration and sharing means and expertise and resources to make sure that we use efficiently available resources for these two diseases. Number two, when we develop our policies, we also make sure that these policies are developed in a way that it strengthens the implementation of the strategic plans of these two group of disease, malaria and NTDs, so that we don't have any disease left behind just because it doesn't have any big visibility. So we don't want to keep NTDs remaining neglected. We want to have them having the same visibility with malaria, and really it works. I think this is the experience of Rwanda of going for integration and for putting together some resources that are available to make sure that it helps the implementation of mission of these two programs. In some countries, you might find that they are separated, they're in different departments. So for the capacity building, the way we addressed capacity issues, again, we have in the Ministry of Health a program called Human Resource for Health, with the intention of reinforcing capacity of staff, especially for their training at postgraduate level, being doctors, epidemiologists, and other experts in health domain, so that we can have sufficient staff who can work for these two diseases. And we will collaborate with the other sectors like the IT sector, especially for mapping places where we have endemicity of this disease. Like recently worked closely with the Ministry of Technology for mapping area where we have mollusks for schisto, and then we can have this map which help to advocate for resources from other sectors to come and address either there is issue of clean water, then people are just infected because they are going to look for water in some lakes. Then the Ministry of Infrastructure, we just came and realized that if we solve the issue of clean water here, people will not be exposed to go and be infected by mollusks when they are going to look for clean water. And so we are using those data to advocate for the control of disease. So that's the way we work together with different sectors to make sure that we address some capacity issues. If we don't have capacity in the Ministry of Health, we can look them in different sectors, like the IT high capacity level in terms of GIS. We can use colleagues in other sectors to make sure that we fix these kind of issues. So this is just an example I'm giving to show that in multi-sectoral collaboration, we can solve different issues of capacity building or capacity that are not within the sector. But we look for this capacity in other sectors in the government of Rwanda.
Thank you very much for that, Honorable Minister. And you know, they say time flies when you're having fun. I've just looked at my clock and realized that we're pretty much run out of time. It's been such an engaging conversation, and I've really appreciated that. And also to the attendees, thank you very much for all the forthcoming questions and comments that you've been putting into the chat. So we haven't quite managed to address all your questions, but what we will do is we'll ensure that we'll take those questions and respond to those questions post the event where we're able to. But I would like to give our panelists just a few seconds to give us some parting words, something to motivate and inspire, something that's burning on your heart. And if I can please start with Lynn. You're on mute, Lynn.
Okay, can you hear me now?
Now we can hear you.
So yeah, thank you, Joy. I really think we need to reflect on the fact that we have quite lofty goals in looking to control and eliminate NTDs like STH and Schisto, and that really we have to work together. It's not an option. It's a necessity. And I think that as we work together and strive towards sustainability, sustainability to me is a sign for governments that we're making progress and that we're able to bring things forward. So we're in this together, which has become a very much a catchphrase during this year of the pandemic, but I think ever so true as it relates to NTDs.
Indeed. Thank you, Lynn. And if I can pass the baton on to Sean.
Well, happy World Water Day. Thank you all for this wonderful event. And it's funny that Lynn said that, because what was going through my mind was I wanted to end with, we are together. So we're together, and thank you for your collective efforts to, and on behalf of children around the world, we just want to say thank you. Thank you for those collective efforts and for the focus for many years on ensuring that children live better lives.
Thank you, Sean. And to you, Johannes.
What can I add? It has all been said. But just very quickly, partnership collaboration, absolutely at the center of all our activities. We prove the point here today, as you said, Joy, on this panel. We are absolutely delighted that schisto elimination is now firmly on the menu, if I put it so flippantly. We are absolutely delighted that Rwanda is there, ready to prove the point that schisto elimination is possible, that NTDs can be tackled, and we are hugely excited and motivated to do our best to be in this together. Thank you.
Thank you, Johannes. And lastly to you, Honorable Minister.
Thank you so much. I think take-home message for me is that NTDs, especially those two we talked about, intestinal worms and schisto, they are really beyond being health problem issue only. They are multi-sectoral, multi-factors driven issues. And then partnership, multi-sector partnership is really a solution. We can't only address this issue by drugs, but we need to go beyond and provide what is required in terms of required infrastructure, but also and mainly behavior change, because we need to engage our community to change and to adopt responsible behavior and use these facilities properly. This is the whole message for me, to make sure that we engage our population to use whatever we are giving, drugs, infrastructure, and themselves to change their behavior.
Wonderful. Thank you, Honorable Minister. And thank you to all our attendees again. To our panelists, thank you for making the time to join us today. I wish you all a pleasant day further. You may log off now as you do, but we'll play one video again as we end off. Thank you. Have a good day from the End Fund.
Thank you.
Nitwa Nyirangaruye Gerardine, mfite imyaka 15. Itandukaniro mbere batari batanga iyi miti twasinziraga mu ishuri no kuruka tukaruka n'ibindi. Impamvu bari gutanga ino miti ni ukugira ngo tutandura indwara z'inzoka. Nimara gukora ndangije amashuri numva naba umwarimu. Mbona yuko kwigisha ari byiza, nkigisha abana b'u Rwanda kugira ngo bamenye ubumenyi.
Impamvu natowe n'abaturage banyira icizere, mba mbaye umujyanama w'ubuzima, nkorera hano ku kigo nderabuzima cya Gashari. Ndakishimira rwose kandi ngakora mfite umurava, kuko nshinzwe kubungabunga ubuzima bw'abaturage. Ndabyishimira cyane rwose. Mu giturage, muri kominote, izo ndwara zaragabanutse aho haje iyi gahunda yo kuvura abana inzoka zo mu nda. Byaragabanutse. Kera wasangaga umwana yaratumbye inda arizo nzoka zipakiyemo, ariko none aho tugiye dutanga ibyo binini by'inzoka nk'abajyanabuzima, nta nzoka zikigaragara mu bana. Kandi n'ikimenyimenyi murabona bari abana turi gupima, turi guha biriya binini by'inzoka, muri kubona bafite ubuzima bwiza nta kibazo.
Thank you all. Bye-bye.
Bye.